Would you be surprised to see people with hair all over their faces, a 5-year-old boy or girl who looks 50, or a person whose teeth look like fangs? Well, these aren't hypothetical conditions. They are actual illnesses that affect a select few unlucky people. In this video, we will be looking at some of the diseases that exist in this world that you haven't heard of, so stay tuned and enjoy the video. Persistent sexual arousal syndrome. Picture being on the brink of orgasm 24 hours a day, 7 days a week. Does that sound too wild to contemplate? Unfortunately, this is not the case for those suffering from persistent sexual arousal syndrome. This rare, peculiar neurological and possibly hormonal condition is characterized by persistent, intrusive genital arousal that has no connection to sexual desire. It can affect individuals of any age or gender and is so distressing and embarrassing that sufferers may even contemplate suicide. Although no definitive cause has been identified yet, scientists think that it may be caused by extremely sensitive nerves in the genitals. The syndrome was first diagnosed in 2001, and because it is a rare condition, researchers are still trying to understand what causes it and which treatments work best. Human werewolf syndrome. We all have a certain number of unwanted hairs on our bodies. However, what if individuals, regardless of gender or age, sprout thick hairs on their faces and bodies? It is possible because some individuals are born with additional genes on a particular region of the X chromosome, which results in excessive hair growth. This is known as congenital hypertension syndrome. Furthermore, this condition is commonly associated with tooth defects. Therefore, it is no surprise that the syndrome is called human werewolf syndrome. It is a very rare condition, with only approximately 50 cases reported worldwide since the Middle Ages. Although the medical significance of the syndrome may be limited, it is certainly embarrassing and can lead to a considerable emotional burden. Treatment options, such as laser hair removal, are available. However, the hair typically returns to the body and face. Tree bark skin disorder. When a single wart on an exposed area of the body may cause discomfort, imagine what would be the sensation of having an entire body covered in warts. Unfortunately, this is the reality for some individuals who are diagnosed with epidermodysplasia verruciformis, a genetic skin disorder that causes eruptions of lesions resembling warts that can appear anywhere on the skin. One of the most common types of lesions is reddish-brown, with a scaly surface and irregular borders, while the other is found on sun exposure skin and is often slightly raised and brown in color, similar to tree bark. The lesions are typically caused by an infection with a type of HPV, which does not usually cause any lesions. However, in individuals with epidermodysplasia verruciformis, the virus does. A major worry for these individuals is that the lesions may develop into skin cancers, for which there is no known treatment, and it can be only managed through medication, surgery, and counseling. Accelerated aging syndrome. Pereria, also known as accelerated aging syndrome, is another rare disorder in which children may begin to appear elderly even before the age of 2. Without impairing their intellectual development and body movement skills. Symptoms of accelerated aging syndrome include prominent eyes, a narrow nose with a beak tip, thin lips, and a small chin, as well as protruding ears. Other signs of aging may include hair loss, skin aging, joint abnormalities, and a decrease in fat beneath the skin. Patients with accelerated aging syndrome develop severe hardening of their arteries beginning in childhood, which can lead to heart attacks or strokes at a young age. This is a potentially life-threatening condition, with an average life expectancy of 15 years for children with the condition. Although some may die younger, and some may live longer up to 20 years. There is no cure for accelerated aging syndrome, however. New treatments and research have shown some promise in managing symptoms and complications. Porphyria. Slight sensitivity to sunlight, skin reddening and blistering when exposed to the sun, garlic causing severe abdominal pain, and retracting gums that look like fangs. These are just a few of the vampire characteristics that we have all heard about in movies and books. But can you believe that there is a disease that has all of these as symptoms? Yes, porphyria is a rare disorder that is caused by a buildup of natural chemicals in the body known as porphyria. These chemicals are necessary for the formation of hemoglobin, a protein in the red blood cells, which carries oxygen to organs and tissues throughout the body. To make hemoglobin, 8 enzymes must be present in order to convert porphyria into hemoglobin. When these enzymes are not present, the body accumulates too much porphyrin, which can cause serious damage to the nervous system, skin, and other organs. The symptoms of porphyria can vary depending on the type and severity of the disorder. Generally, there are 2 broad categories of porphyria. The first one is acute porphyria, which starts quickly and primarily affects the nervous system, and the other one is cutaneous porphyria, which mainly affects the skin. Although there is no cure for porphyria, medications and lifestyle changes may be beneficial in managing the symptoms. The living statue syndrome. The living statue syndrome, or fibrodysplasia ossificans progressiva, is another rare, painful, and disabling genetic condition in which bones develop in the muscles, tendons, ligaments, and other connective tissues of the body. The bones developed across the joints limit the body movement and form a second skeleton, making the body look like a living sculpture. Symptoms usually develop gradually over a few months or years. Muscle stiffness and discomfort may come and go, but the stiffness becomes fixed over time. Many people experience painful muscle cramps that can last several minutes or several hours and affect the entire body or some muscles. These muscle cramps can be caused by sudden loud noises, light contact, cold environment, stress, or by situations that cause increased emotions. There is no known effective treatment for this disease. Injuries or surgeries can only worsen the condition. This genetic disease does not have any ethnic, racial, or gender patterns and has been found to affect just 1 in 2 million people. Alien hand syndrome. Alien hand syndrome is a rare neurological condition in which one hand acts independently of the rest of the body. In some cases, one leg may also be affected, although this is less common. People having this disease feel like their hand is not under the influence of their mind and moves as if it has a mind of its own. During these episodes, the affected hand feels alien to its owner and appears to move intentionally to complete tasks that are not intended. The cause of alien hand syndrome may be due to a variety of factors, such as stroke, trauma, or tumor, and is sometimes linked to cancer, neurological degeneration, and aneurysmal brain tumors. There is currently no cure for the condition, and therapies and pharmacological options are not yet developed. People with alien hand syndrome who have suffered a stroke or brain disease may recover after a period of time. However, this is less likely to be the case for those suffering from neurodegenerative diseases. Congenital insensitivity to pain. Have you ever seen an ascetic walking over red-hot coal with a calm look on their face? Well, it could be a bluff or a superstition, and scientists have tried to explain it in different ways. There is a strange genetic condition where patients don't feel pain in any area of their body, even when they are hurt. For instance, a person with this condition can't feel when a hot drink burns their tongue. This type of pain sensitivity can cause wounds and bruises, as well as other health problems that go undetected. This is a disorder affecting the nervous system, and the nervous system is the part of the body that connects the brain, spinal cord, muscles, and cells that sense sensations like touch, smell, and pain. It is thought to be caused by a mutation in a gene that controls pain-sensing neurons. There is no any effective treatment for this disease, and the only treatment available is primarily focused on staying safe. Fish odor syndrome. Imagine having a strong fish odor whenever you speak to someone or yawn. The smell is also emitted when sweating or urinating. This is the result of a rare metabolic disorder known as trimethylamine syndrome, also known as fish odor syndrome. This disorder is caused by a defect in the production of the FMO-flavin enzyme. It is an inherited disorder and is more prevalent in women than men. Scientists do not know the exact cause of this disorder. However, they suspect that the presence of female sex hormones, such as progesterone and estrogen, may exacerbate the symptoms. People who menstruate may experience an increase in the presence of fish odors prior to and during menstruation. Fish odors may also become more pronounced when taking birth control pills or as a woman nears menopause. Food allergy. Most people have some sort of food allergy. Maybe you are allergic to peanuts, maybe you have been allergic to tomatoes or shellfish or corn or eggs, and so many other foods. But have you ever heard of someone being allergic to all food? It's a relatively new disease, but it's one that has been around for a while. It's a condition where the lining of your esophagus gets inflamed or swollen, and a white blood cell called eosinophils starts to appear. People with this disease have difficulty swallowing, and the esophagus narrows to the point where food gets stuck inside. This is known as food impaction, and it's a medical emergency. This is also a disease that is either inherited or related to impaired brain function. Hence, there is only a little one can do about the disease except pray that things don't get worse for them and their family. Alright, before closing the video, which of these diseases do you think are the worst to have in a human being? Let us know that in the comments section below. Thank you for watching the video, and if you like this video, please press the like button and subscribe to the channel for more videos like this.